The CDC is saying that the Omicron variant has now been found in some 36 states. The 7-day average of daily new cases nationwide is approaching 120,000. Folks, that's the highest in about 3 months. The CDC projects the country will see 1.3 million new cases during Christmas week. Meanwhile, the United States has surpassed 800,000 COVID-related deaths since the onset of the pandemic. Last night, the Washington National Cathedral rang its bells in tributes to the lives lost. President Biden also issued a statement earlier this week marking the tragic milestone and urging people to get vaccinated. With more on this, let's bring in Dr. William Schaffner. He's a professor of infectious diseases at Vanderbilt University Medical Center. Doctor, thank you so much for being with us. As you know, the CDC is warning of new cases rising by 55% as we approach Christmas week. The question, of course, is, are we in a situation right now, doctor, with the rise of these variants? You've got Delta, you've got Omicron, where everybody at some point is in danger of getting infected, but the reaction to the infections will be very, very different for the folks who are vaccinated and the folks who are unvaccinated.
Vlad, you've got it exactly right. The people who are unvaccinated continue to be at high risk of acquiring an infection that's serious enough to put them into the hospital and the intensive care unit. Whereas the people who are vaccinated, particularly those who are boosted, are likely to get a very mild infection, if that at all, something akin to a bad cold. There's a big difference between the two, and vaccination makes that difference. We still have so many adults unvaccinated, and so many parents still have not brought their children 5 and older in to be vaccinated.
Doctor, often we talk in terms of numbers when we're talking about COVID, and I want you to sort of put this number in context for us. The U.S. has surpassed 800,000 COVID-19 related deaths. That's more than any other country. So help us add some context to this really staggering number.
Well, Emery, it is a staggering number. It is difficult to get your minds around a number that large, but bring it down to the neighborhood. There's no one who doesn't know someone who's been either hospitalized or, more seriously, having passed away as a consequence of COVID. And so this is an infection that has penetrated absolutely every community and every corner of every community in this country. It's still going on, and we still need to work hard to curtail it. We can do this. It's been shown. Vaccination plus boosting really does offer protection.
So, as you know, Doc, people across the country are rushing to get a COVID-19 test. This comes as the FDA says it has identified 3 different COVID-19 tests that will fail to detect infections in people who caught the Omicron variant. So what is the process of finding out which variant your patients have, and how critical is testing now? I mean, I know at the start of the pandemic back in March of 2020, that was really important. Contact tracing was really important. But as we said, as sort of at the top, the landscape today is very different to the landscape in March of 2020. So how important are these tests?
Well, the tests are important often in a local circumstance where we can find cases that are spreading. For example, several universities have done routine testing of their students, have determined that Omicron is in the student body, and they can then notch up their mitigation efforts. The masks go back on, social distancing is back in vogue, and that helps us determine what's happening. We won't be able to tell each and every patient who has an illness whether they've had Omicron or Delta. I can tell you that over 90% of new cases today still are Delta. And I'll come back to my theme: vaccination protects against serious Delta.
So I want to ask you about this, the Johnson & Johnson shot. There's a chance that the CDC may limit the use of that single-dose vaccine due to a rare blood clotting complications. We heard about this before. This is not new, but the CDC is taking a second look at data. What would lead the agency to consider making this move?
Well, I'll be sitting in on those meetings today virtually and listening to the debate and participating in it. We will get more information on the frequency of this rare blood clotting disorder, and my colleagues will debate whether we should continue to use this vaccine, the J&J vaccine, or whether its use ought to be curtailed and limited just to certain populations. There's much less of the J&J being used at the present time than there was. Most of the vaccine by far that we're using today is either Moderna or Pfizer, and we have plenty of that vaccine.
So, doctor, let me ask you about Nashville, Tennessee. What are you seeing in your neck of the woods? What are you hearing and seeing from your patients?
Yeah, Vlad, I'm taking a deep breath. We are a very under-vaccinated state here in Tennessee. Our cases that are serious, requiring hospitalization, have ticked up. So we're very concerned that as we go into this extended holiday season, we will see more cases because so many of our friends and neighbors still have not availed themselves of vaccination. And there is concern that Omicron also will accelerate this. That's sure to happen within the next several weeks. We've already had Omicron detected in Memphis. That's in the western part of the state. It'll be here in no time at all, I'm afraid.
Yeah, that you're most likely right. Dr. William Schaffner, thank you so much.
Thank you.